Welcome to this webinar in which we're launching a new FAO and ILO report entitled Extending Social Protection to Rural Populations, Perspectives for a Common FAO and ILO Approach. I'm Alejandro Greenspoon, Senior Economist at the Social Protection Team in FAO Rome, and I will be moderating the session. We're having this panel at a very critical moment. COVID-19 has upended the lives of millions upon millions of people around the world. This is a time when we're seeing a reversal of the progress made in reducing poverty in recent decades. We're also seeing an alarming increase in hunger and chronic food insecurity and a widening of inequalities among as well as within countries. COVID-19 has affected everyone around the world, but not everyone has been affected in the same way. The pandemic, in fact, has accentuated rural vulnerabilities, has worsened the conditions of those who were already living hand to mouth, and has put millions of families who were vulnerable but not poor, at the risk of falling into poverty traps. We've all heard the projections of about 120 million more people falling below the $1.90 poverty line a day by the end of 2021, and of 130 million additional people becoming chronically undernourished. This is putting the world very much off track and off path to meeting SDG 1 on ending poverty and SDG 2 on ending hunger. It is indeed a critical moment, but at the same time, on the positive side, the crisis has also triggered a swift response from the social protection sector. Social protection has actually featured front and center in countries' responses to the pandemic, along with measures to support businesses, sustain employment, and keep food systems alive. Social protection programs have expanded both horizontally to reach new beneficiaries and vertically to provide more generous relief to those affected by the crisis. Eligibility rules and registration procedures for receiving social benefits have been relaxed. Conditions for receiving those benefits have been waived or eliminated in many cases, and delivery systems have been strengthened, including through the use of technology to allow programs to continue to operate in the midst of lockdowns and bans on public gatherings and movement. Many countries have introduced unemployment and other benefits for informal workers, yet the nature of the response has in many cases been short-term, insufficient to make up for the loss of income and livelihoods, and characterized by a huge fiscal stimulus gap between rich countries able to incur massive deficit spending to prop up consumption, businesses, and jobs, and the majority of countries where domestic resources and fiscal space for counter-cyclical measures are hugely limited. Despite the commendable response from the sector, the crisis has exposed how far we still are from the goal of ensuring the progressive realization of the right to social protection. 6 years after the world adopted the Sustainable Development Agenda, which pledged every country to implement social protection systems and measures for all by 2030, including social protection floors, 70% of the world the world's population still has no access to comprehensive coverage. According to ILO estimates, only 45% of the population globally are effectively covered by at least one social protection benefit, while the majority are left unprotected. This is the reality for most workers and their families in the informal economy, which in many, if not most developing regions, accounts for the bulk of the workforce. It is also the reality for most people in rural areas where informality, casual and seasonal employment, and unremunerated family labor are the norm, and where low and irregular income prevents agricultural workers from contributing to social insurance. In the context of COVID-19, being denied access to social protection means that workers and their families are left to fend for themselves. This is why the report that we're launching today is so timely. The report discusses the specific features of rural populations and the barriers they face to access social protection, and it outlines the innovative measures that many countries have adopted to extend coverage in rural areas. We have great speakers today, both from international organizations and government, so I look forward to a stimulating discussion. We will first hear from Benjamin Davis. He's the director of the Inclusive Rural Transformation and Gender Equity Division at FAO, and from Ms. Shahra Razavi, director of the Social Protection Department at ILO. Ben and Shahra will be presenting the highlights of the new FAO ILO report, and they will be followed by government representatives from 4 countries, Ms. Cecilia Mbaka from Kenya, Hazim Rahaleh from Jordan, Ezequiel Barbenza from Argentina, and Ms. Ariunzaya Ayush from Mongolia, who will be joining by video. Then Christina Behrend of the ILO will give some words as a discussant, and there will be a Q&A session at the end of the webinar. So I would like to encourage the audience to send questions by clicking the Q&A button at the bottom of your screen. Please, when posing your questions, do indicate which of the speakers you are addressing the questions to, and also your name and organization. So without further ado, may I invite our first two speakers, Ben and Shahra, to launch the report. Many thanks.
Thank you, Alejandro, and hello to everyone participating in the seminar. It's a pleasure and an honor to be here with you today. I'll give the first part of the, let's say, the short presentation on the new report. First, the context, but currently about half of the world's population and over 3/4 of the world's poor population live in rural areas. These rural populations are 3 times more likely to live in extreme poverty than urban populations, and are more likely to be in informal employment. Rural populations in general face higher exposure to risks, including working in poverty, malnutrition and hunger, poor health, work-related injuries, natural disasters, and climate change. I think we all know that social protection is a fundamental human right. It's key to realizing other economic, social, and cultural rights, including the right to food, health, and education. Social protection has been recognized as an important component of poverty reduction strategies by governments around the world, as well as being pivotal to ensuring access to basic services, promoting decent work and inclusive economic growth, and increasing resilience to shocks. But as Alejandro mentioned, access to comprehensive social protection is still far from a reality for most of the world's population, a disproportionate number of whom live in rural areas. The COVID-19 pandemic exposed the large gaps in coverage and the inadequacy of national social protection systems. It's made more clear than ever, I think, the role of social protection in terms of protecting lives and livelihoods. This was confirmed by the surge of government programs following the outbreak of the pandemic. Yet most of the measures that have been put into place are temporary. Some have already been phased out, and important gaps remain in coverage. To address the crisis and the building back in a more effective and lasting way, and increasing resilience into the future, more permanent solutions are essential, particularly with respect to ensuring universal access to adequate social protection for all, including rural populations. So in this sense, we must make every effort to extend social protection coverage to rural populations and address the many barriers that they face in terms of accessing social protection programs. In this report, we identify the legal, financial, and administrative barriers to accessing social protection. Next slide, please. Some categories of rural workers are explicitly excluded from legal frameworks, and there are minimum thresholds regarding the duration of contract, working hours, or covered salaries can exclude rural workers from effective coverage. Many schemes also exclude international migrant workers. Financial barriers include the affordability of the uptake of social insurance, and smallholder farmers, for example, tend to have limited contributory capacity due to their low, highly variable and seasonal earnings, while liquidity constraints that they face often make them prioritize other more pressing immediate needs. Additionally, complying with the administrative requirements often entails significant transaction costs, such as traveling to the Social Security offices. It can also be hard to calculate the social insurance contributions for some agricultural workers, as they have volatile incomes, and part of their incomes may be non-cash or in kind. The administrative procedures for providing or accessing social protection may be more challenging to implement in rural areas. Governments may lack the administrative capacity to identify, reach, and register rural populations and implement social protection schemes. The remoteness of rural areas and the lack of access to quality services also increases the cost of both providing and accessing social protection. The poor coverage of civil registration and national identification systems can create difficulties both for service providers to reach vulnerable groups in rural areas, as well as for potential beneficiaries to qualify and apply for benefits. The lack of information or awareness can also hinder access. And fragmentation in social protection systems can lead to gaps in coverage and to duplications and inefficiencies. I would just like to highlight the important role that rural organizations can play in terms of addressing these challenges and barriers. Rural organizations can serve as an intermediary between agricultural workers and social security institutions, and can enter into collective agreements with a social insurance scheme. They can also provide information and raise awareness among rural workers and employers. And in this regard, rural organizations should be motivated to participate in the design, implementation, monitoring, and evaluation of social protection policies and schemes. Next slide, please. There's two broad approaches to extending social security, social protection to rural populations. The first is strengthening and adapting social insurance mechanisms to ensure the adequacy of benefits, both in terms of broader scope and higher levels of protection and based on solidarity, and the strengthening of tax-financed non-contributory mechanisms to ensure a basic level of protection for everyone, including those not covered by other schemes. I just want to make one last final point, or two last final points. I think it's important to remember that social protection alone is not enough to address all the constraints faced by rural households. People need jobs and livelihoods. And in rural areas, agriculture as the primary economic activity in many countries, and social protection can play complementary roles. Agricultural interventions can promote productivity of smallholder farmers by addressing the constraints that they face in the productive process, while complementary social protection interventions can help alleviate household liquidity constraints and enhance the ability to invest and take risks and adapt to climate change, for example, thus improving access and benefit from these agricultural interventions. Evidence shows that combined interventions can be more effective in terms of combating hunger and poverty. But it requires political commitment, policy architecture, institutional arrangements, financing, and adequate human capacities in order to achieve this coherence. Finally, social protection has a key role to play in terms of making food systems more resilient and inclusive. Social protection programs can improve access to safe and nutritious food for the poor and the vulnerable, and create incentives for nutritious and healthy diets, which is particularly important for children in order to realize their full potential. Social protection programs also, if well designed, can encourage sustainable natural resource management. So for this reason, FAO and the ILO are joining hands to promote the extension of social protection to rural households and to better tap the role of social protection in combating poverty and hunger, as well as realizing the other sustainable development goals. Thank you very much. Over to you, Shahra.
Great, thank you very much, Ben. Thank you, Alejandro, for the introduction, and it is a real pleasure to be here and to be sharing this panel with you, Ben, and also to be introducing a publication that I'm very proud of as a joint FAO-ILO publication. I think it was a pleasure doing this work and reading the outcome. And I'm really looking forward to hearing all the other panelists. So I think it is indeed a much needed recognition, what you said about also recognition of the heterogeneity and diverse needs of rural populations, which can sometimes get forgotten. Just living in rural areas does not mean that people who live in rural areas are all the same. And this recognition is really important. And it is essential to combine ILO's and FAO's respective mandates and expertise to really be able to support countries in extending social protection coverage to agricultural workers and other rural populations in a way that really strengthens social protection systems, promotes decent work in rural areas, including in agriculture, and facilitates the transition from the informal to the formal economy. So if we can move now to the next slide on exploring innovative approaches to extending social protection. So having said all the things that Ben said about the requirements of what kind of social protection programs are needed, for particularly populations who live in rural areas, let's look at a few innovative approaches in this respect. And I'm not going to go into detail because we're going to hear more about some of these examples in a couple of minutes from our distinguished panelists. So just looking at the whole issue of the need to adapt policy, legal, and institutional setups that Ben also referred to. Now, where workers in the rural economy are not yet covered by national legislation, and this is the case in many countries, they should be brought under the protection of the law. This could be done by extending the general social security legislation to agricultural workers, as has happened, for example, in Ecuador and Jordan, or in countries where this is not possible, by introducing specific legislation for these populations, as countries like Algeria, Brazil, and Colombia have done. And we will hear a little bit more about the Jordan example later on. Then we have the whole issue of facilitating access, registration and administration. Again, examples of successful measures include facilitating of access through, for example, mobile social security offices as they exist in Brazil and in South Africa, or setting up one-stop shops or digital services, as in the case of Mongolia, or reducing the need for people having to produce all kinds of supporting documents, and really simplifying the procedures that exist so that access can be facilitated. As well as through things like collective registration agreements, which exist, for example, in Costa Rica. And we will hear examples from Argentina and Mongolia in a bit more detail later on. Then there's the whole kind of difficult issue of adapting financing arrangements, contribution collections and reference earnings, particularly issues that are affected by seasonality of people's earnings and incomes. So in many countries, we have seen that there have been effective solutions to address the challenges related to the collection and financing of contributions, including adaptations of the way in which contributions and benefits are determined, and also facilitating the payment of contributions, and also, where it's necessary, subsidizing contributions for people who have very low incomes, for low income earners. For example, this has been done in Brazil, Ecuador, and Mongolia. Then I think very importantly is the issue of raising awareness and really fostering trust in the system, which is a challenge everywhere. Now, facilitating access to information on social security rights and obligations, as has been done in Kenya and Zambia, and partnering with agricultural cooperatives or other rural organizations that represent agricultural workers, as is the case in Costa Rica, are really crucial elements to be able to, for countries to raise awareness among the rural population of the rights that they have to social security. And this can really facilitate their interaction with social security institutions. And we're really looking forward to hearing more about how Kenya has gone, in doing so, has gone around this issue of building trust and really making social security institutions a trusted institution that people feel they can resort to, they can contribute to, and they know that they can get benefits from. Then there's a whole issue of ensuring compliance and strengthening incentives, which again is an issue that exists everywhere, but encouraging compliance through adapted labor and social security inspection in rural areas is particularly important, especially with respect to the fact that often there are longer distances involved and there's the issues around seasonality. For example, Costa Rica Social Insurance Institution has gone ahead and employed a group of specialized inspectors to be able to oversee the registration of people who are self-employed. And here they're working in several economic sectors and are adapting their schedules to what is feasible in that context. And then finally, there's the issue of fostering integration and policy coherence. Now, integrated policy approaches that ensure coordination within the social protection system, as well as between the social protection system and policies and other policies, agricultural policies, employment policies, macroeconomic policies, and other related policies are also essential, especially with regard to kind of making just transition towards environmentally sustainable economies and societies. So these are some of those challenges that we're going to hear much more about with some concrete examples from country experts. And if we can move now to the next slide, which is really about trying to build a common FAO ILO approach. I think this has been a real sort of important achievement through the work that we've been doing together. And before diving into the country examples, I think let me briefly just summarize the lessons that we have learned that FAO and ILO have identified as being instrumental in the way we can plan and implement the effective extension of coverage to all rural populations. One is, and I think this point cannot be emphasized enough, is to recognize the commonalities as well as the specificities of different population groups in rural areas. And to reflect this understanding of the specificities in the design, in the financing, and in the implementation and delivery of social protection systems, including social protection floors, taking real advantage of the various approaches and methods that exist. So this is a key issue. Secondly, is very important to promote the participation, the real meaningful participation of all stakeholders throughout this process, to ensure that there is a profound understanding of what the needs are of the groups you're trying to reach through the system. So participating and real meaningful participation of stakeholders is absolutely key. And then we have the whole issue about being very transparent and honest about the implicit and explicit exclusions that exist and that need to be addressed, both in the design and in the implementation of adequate legal frameworks, as well as the actual policies and implementation. And as I said, in addition to this legal coverage, effective coverage really needs to be ensured, including by things like adapting the payment modalities and facilitating people's access, particularly in remote areas where people have to travel long distances, particularly women who are very time pressed may not be able to sort of set aside this huge amount of time to be able to access institutions. So solutions need to be found to these problems. And all of these policies need to be, I think, very much coherently embedded in strategies to formalize the economy, to really bring sort of formality into the rural economy and rural livelihoods. And finally, I think we need to continue making the case for social protection, both as a human right, a fundamental human right, and a socioeconomic necessity for the development of human capabilities, for having growth that is really inclusive, and for having social justice. And I think this crisis, more than any other, has underlined both factors, both the importance of social security as a right, and also the absolute necessity of having it for everyone, and definitely not limiting it to those who live or work in urban areas. So let me thank again all the panelists for joining this webinar, and we're really looking forward to listening to your presentations and, of course, the discussions and the exchanges that we're going to have with the audience. I'll hand over to Alejandro. Thank you.
Can you hear me? Many thanks, Shahra and Ben, for the presentation. It's been a great collaboration with ILO, and the report is very rich, so I recommend it to everybody in the audience. Let me point out that it's available in English, French, and Spanish, along with the brief, with the executive summary, also in the 3 languages. And I think that the links to all of them, the full report and the briefs have already been shared on the chat box. So I encourage everybody to access and read the report and share your comments. And may I also add that we have just finished another report, also with ILO and with the IPCIG, that focuses on the same topic, but with a specific geographic focus on the Near East and North Africa region, on the extension of social insurance to agricultural workers. So we are planning eventually to do similar analyses for the other regions. So thank you so much. And let's now turn to the country cases. We have 4 presenters that are going to be sharing examples of innovations in extending social security to rural populations. So I would like to invite Cecilia Mbaka, Secretary for Social Development and Head of the National Social Protection Secretariat in Kenya, to take the floor. Cecilia, over to you. You have 10 minutes for the presentation. Thank you.
Thank you. Thank you, Alejandro. Could I have, okay, thank you. Okay, thank you so much. Next screen, please. Okay, in line with the ILO recommendation 2, as a country, we are committed to the realization of universal coverage and access to social protection for all. Like in other developing countries, majority of Kenyans live in the rural areas, with about 68.9% of them are living in the rural areas. And the government recognizes that rural populations are 3 times more likely to live in extreme poverty than urban populations, and they face a higher exposure of various risks. Next. Next, please. Yeah, in the last couple of years, as a country, we have experienced a steady economic growth with declining poverty. In 2005, people living below the poverty line in Kenya were about 46%. In 2015, that had reduced by 10%. So we currently have about 36% of the people living in living in poverty. Now, inequality remains high, and especially in the wake of COVID-19, which has deepened poverty. However, in the last couple of years, we have been trying to strengthen the safety net system, and we have established a number of social protection programs. I'm aware that our social protection programs for the elderly, for persons with severe disabilities, for orphaned and vulnerable children, and for the Hunger Safety Net program, that is a program for people living in arid and semi-arid areas. These programs are quite popular, but and they have expanded enormously in the last couple of years, but we still have a lot of gaps. Next. Next, please. On policy and legal frameworks, the issues of social security are enshrined in our constitution. Article 43 of Kenya's constitution, which is a very progressive constitution only promulgated in 2010, says that every person has a right to social security, and the state shall provide appropriate social security to persons who are unable to support themselves and their dependents. And Article 21 further requires the state organs and public officers to address the needs of vulnerable groups, including minority or marginalized groups. And as a result of that, we have come up with several policies and legal frameworks to be able to realize the constitutional provisions. And among them is the National Social Protection Policy. Next. I would like to share with you some of the innovations that Kenya has made. I'm aware that different sectors have made different innovations to reach out to rural populations, but I would just like to share with you a few of these innovations. And we focus on social assistance, social security, and social health insurance. And I'll start with a project that we are currently running, and that is the Kenya Social and Economic Inclusion Project, whose objective is to strengthen delivery systems for enhanced access to social and economic inclusion services and shock responsive safety net for poor and vulnerable households. It has 3 components. One of the components is to strengthen social protection delivery systems. The next one is to increase access to social and economic inclusion interventions, and then improving the shock responsiveness of the safety net system. Next. On system strengthening, we are in the process of establishing a social registry. The social registry is going to have potential and existing beneficiaries of social protection programs. And in populating the social registry, it's not going to be uniform throughout the country. Kenya is a very diverse country made up of high potential areas, arid and semi-arid lands. And so as we populate the social registry, where poverty levels are above 50%, we shall be doing a census so that every household will be mapped. Where we have poverty levels ranging between 30 and 50%, we shall have what we are calling mass registration, where we shall set up registration points, we shall create awareness, and people can go and register. Other than that, where we have poverty levels of about 30 and below, we shall be doing what we are calling on-demand registration, where people will walk into the offices of social development officers and they will request to be registered. As I said, the social registry will be used by all people wishing to initiate programs for the poor and vulnerable, so that at the onset, they are already known where they are and we don't have to go looking for them. If it is the area of agriculture and they would want, anybody would want to, any institution would want to reach or organization to reach the poor, then they can come into the social registry, get the data and go and cover the people that they would want to cover. Timely and reliable payments. We have contracted about 4 banks, and the beneficiaries have a choice on which bank to go to. The banks are local banks, and if the beneficiaries feel one bank is not serving them well, they can always move to the next bank. There are also many other advantages that come with it. We are also in the process of creating a system for enrolling national safety net beneficiaries into the National Hospital Insurance Fund. We would want to have a structured system that can be able to enable us to track whether the beneficiaries are receiving, are accessing the health benefits and where they are, which hospitals they are attending. Now, other than that, we have also been in the process of strengthening the complaint and grievance mechanism, and I would want to come back to that. The project is also attempting to increase access to social and economic inclusion interventions. And one way it is doing that is expanding nutrition-sensitive safety net through top-up of cash transfers, which means it's benefiting those who are already in the cash transfers. And it is covering those households with pregnant and lactating women and children under 2 years, coupled with nutrition counseling for investment in the early years of life. Now, currently the priority has been given to 5 counties. I forgot to say that Kenya is made up of 2 levels of government. We have the national government and the devolved units, which we call the counties. So we are reaching about 5 counties, and the 5 counties are in the arid and semi-arid lands where malnutrition is quite high. The other thing we're doing is testing various economic inclusion interventions to assess approaches appropriate to inform design decisions for possible scale-up, and then expanding cash transfer in additional counties in the arid and semi-arid lands. Next. On testing of economic inclusion interventions, we are testing different approaches to deliver economic inclusion interventions and models that are simple and they are practical to assess the most effective service packages for scale-up and sustainability in the rural areas. Just like the nutrition program, we are also currently reaching out to 5 counties with the hope that if there are good lessons, then we can be able to expand. And the economic inclusion interventions are contextualized to each county or the devolved units, because as I keep saying, Kenya is very diverse. We are providing startup capital coupled with consumption support to households for 1 year to bridge them from the start of interventions and they start earning their livelihoods. And this is to ensure that they do not use their startup capital on food consumption. On livelihood options, this depends on suitability to the local market and the beneficiary household needs, which means the kind of enterprises that they engage with will vary. And lastly, we are offering training and linkages with existing programs and services. And so we are not really starting any new structures. We're working with what is already existing. Next. On building awareness, as I said, we have established a grievance and case management system to improve our citizen engagement in the sector by shortening the time to address complaints and also strengthening weak areas such as lack of feedback by establishing hotlines in various programs, holding service providers accountable. We have also decentralized the G and CM to the devolved units so that they are not only at the national level. And we have also attempted to strengthen citizen engagement through improved beneficiary outreach strategies, which are well disseminated. Next. In the area of health, until 2015, the National Health Insurance Fund here in Kenya only focused on the formal sector and only provided the inpatient cover. However, in 2015, this changed, where the fund increased premiums that allowed the National Hospital Insurance Fund to provide insurance for a health package that can be assessed in public, private, and faith-based hospitals. And the benefit package is negotiated with the hospitals. And when a member goes to the hospital, they can be able to access the benefits as per the contract between the hospital and the National Hospital Insurance Fund. And if the services are more expensive than the negotiated package, then the member will co-pay the difference. And those are the kind of services that are offered. Now, if the treatment is not available in Kenya, one can be able to access treatment abroad, although that should not exceed $5,000 US. And if it does, then the family pays the difference. Now, with this, more people in the formal and informal sector in both rural areas and urban areas have joined the health scheme. The members contribute about $5 US. And currently, the National Hospital Insurance Fund is covering approximately 24 million people, which is about half the population in the country. Now, they have leveraged on technology that ensures real-time registration and contribution through the mobile phone. Next. In the area of Social Security, the National Social Security Fund in Kenya has introduced an innovative arrangement for contributions using mobile money technology for the informal sector, where they are able to register to contribute, and also the National Social Security Fund can be able to respond to queries from workers in the informal sector in both rural and urban areas. They are able to pay as daily payments, which is about Kenya shillings 25, which is like a quarter of a US. And per month, they are able to pay about $7 US. Now, payments can be made either daily or weekly or monthly in small amounts, and they can contribute it from anywhere. And so the National Social Security Office is actually in the members' phones, so it becomes then very interactive. Arrangements have also been made with the mobile phone service provider for check-off as long as one has money in the mobile phone. It also allows them to withdraw up to 50% of accumulated benefits with interest after a minimum contribution period of 5 years. So that is what I would want to share with you. As I said, I know there are very many other innovations out there, but that is what I was able to share with you today. Thank you.
Many thanks, Cecilia, for a great presentation. Just a couple of points to highlight. One is the measures that you presented that Kenya has been taking for some time now to strengthen information and delivery systems, including beneficiary outreach and the handling of grievances, or the example you just mentioned about the use of mobile platforms for payments to the NSSF. And also the efforts to improve coordination among social protection programs, particularly through the NSNP. You also mentioned that the right to social protection is embedded in Kenya's constitution and legal and policy framework, and that social dialogue and participation by trade unions and employer organizations are part of the policy-making process. And the last point is about the efforts being made to extend health protection through the NHIF, and to link access to social protection to other complementary services and interventions, including livelihood support, savings and financial services, as well as agricultural inputs and training. So let's hear more about that during the Q&A session. Just to remind everybody to indicate your name and organization when posing the question, as well as the speaker that you're asking the question to. And I would like to turn to the next speaker and invite Hazim Rahahleh to take the floor. Razim is Director General of the Social Security Corporation in Jordan. The floor is yours, Hazim. Thank you.
Thank you, Alejandro. And it's a pleasure to be with you today to explain the efforts that Jordan has taken to extend coverage of social protection. Next slide, please. So basically, Jordan has two social protection systems. The first system is contributory-based system, to which we have two schemes. The first one is Social Security Corporation scheme, which is managed by the Social Security Corporation and is financed through the payroll contributions from both employers and employees. The other scheme is the civil and military scheme, which is financed through the general budget and covering the military and civil servants. The other system that we have is the non-contributory system, which is the National Aid Fund, focusing mainly on a non-working poor, and it is financed through the budget from the general taxes. On the Social Security Corporation scheme, it was initially established to cover the private sector workers, starting from large firms and gradually extending the coverage to include small firms below 5 employees. However, in 2008, a decision has been taken to extend the coverage to include smaller firms hiring less than 5 employees. The government in 1995 decided to include all newcomers to the public sector under the Social Security scheme, and the same decision was taken in 2003 to enroll all military servants under Social Security scheme. So basically, the civil and military scheme is phasing out, and Social Security scheme is becoming the national umbrella for all workers in the private and public sector. Next slide, please. Over around 3 decades, Social Security scheme was implementing only 2 types of insurances. The first one is the old age, disability, and death insurance. And the second insurance was the work injuries and occupational disease. In 2010, a new schemes were introduced, the unemployment insurance, which is covering now the private sector workers, and it's totally based on the individual saving accounts principle. And we have the maternity insurance, which covers the private sector workers and financed through a payroll contributions from both the female and male workers. The insurance covers maternity leave allowance for 10 weeks, and it has been expanded recently to also provide a subsidy for the nurseries. Until today, Social Security scheme is covering around 65% of the labor force. The rest, the 35%, who are still uncovered, are working in small firms, mainly in less than 5 employees. The agriculture sector is self-employed in the agriculture and free occupations. Next slide, please. So basically, several challenges has impeded the coverage extension towards the most fragile, most in need. I just made a classification for those challenges, basically starting with the payment capacity. Currently, SSC contribution rate, the total rate is 22% out of the total wage of the employee, which is quite beyond the financial capability of the small firms, and also for the self-employed, especially that usually they have unstable income and they cannot afford to pay the 22%, the full contribution rate. The other problem that we have is the adverse incentives embedded in the non-contributory scheme, the National Aid Fund, because it is only covering the non-working poor. So there is a disincentive for workers to report to the National Aid Fund that they are working, because they will be exempted. So basically, this works against the incentives to join the Social Security scheme, and this is also driven by the myopic behavior by the low-income earners and the less educated. So the incentives are working against the inclusion of the most in need workers. We had before a problem with enforcement. The regulatory framework was not ready enough to provide more enforcement to join the umbrella. What SSC has made during the last 2 years in order to overcome those challenges, a set of measures has been adopted, basically starting with the passing a new bylaw allowing the self-employed to join the SSC umbrella through a tranches system. A tranches system allows workers to join the umbrella through different contribution rate settlements. So basically, we have 4 tranches. It's based on pro rata arrangements on the benefit side. So we allow the workers to partially included in the old age insurance while covering them under the maternity, unemployment, and work injury insurance, which means that the contribution rate could go below 8% as opposed to 22%. we have also introduced a new scheme for the new establishments in the agriculture and IT sectors, in the sense that they can be exempted from the coverage of old age insurance while being covered in the disability insurance, maternity, work injury, and unemployment insurance. We will start implementing both schemes, the tranche system scheme and the exemption scheme from old age in coming May. This is on the measures that has been considered in order to address the problem of payment capacity. On the incentive side, what we did that NAF, the National Aid Fund, is working on rearranging the criteria for eligibility, basically introducing a new scheme that covers the working poor. So if you are working in the private sector or in the public sector, you still be eligible to get a subsidy from the fund. The pandemic, the COVID-19 pandemic, was a great opportunity to Social Security system to boost the trust in the system. So SSC has introduced a wide range of programs covering almost 80% of the current contributors through advanced payment, pension payment arrangements, through job retention program. So it has retrieved the confidence in the system, with also the work on the other scheme, which is the non-contributor scheme. I think the incentive environment now is working well with extending the coverage to the most in need workers. We have also linked all the licensing process from different governmental departments, authorities, with the coverage of Social Security. So basically, you cannot get a license, you cannot get a permit, movement permit in the context of COVID-19 without being covered by Social Security. We are also working with our partners, the regulatory authorities, to enhance the coverage of their members. So for instance, we'll start covering the taxi drivers in May 2021 by linking the license to the coverage of Social Security. So Alejandro, this is a quick overview about Social Security initiatives to extend coverage to the most in need workers. Thank you very much.
Thank you, Hazim. One thing that the presentation shows is that Jordan has been making a sustained effort over many decades, since 1980, to extend the coverage of contributory schemes to workers employed in smaller businesses and to broader categories of workers, including the self-employed. But at the same time, as you mentioned, despite the changes in the Social Security provisions, challenges remain for the smaller firms in terms of affordability. And I also noticed that along with the expansion of coverage, Jordan has also made an effort to make social protection more comprehensive by covering more risks and adding new benefits over time, which is in line with the principle of progressive realization of the right to social protection. On the question of adverse incentives in the National Aid Fund, I was just wondering, maybe we can take it up later, if you have, if I understood correctly, you have not considered defining eligibility based on some measure of need, regardless of the occupational or the employment status of the beneficiary. But thank you very much for the presentation. And we need to turn to the next speaker, and that is Ezequiel Barbenza. Ezequiel is Director of Registration and Formalization at the Secretariat of Family, Peasant, and Indigenous Agriculture of the Ministry of Agriculture in Argentina. Ezequiel, adelante. Gracias.
Thank you, Alejandro. It's an honor to me to be part of this panel. Next slide, please. In Argentina, in the 90s, a simplified system of tax and social care was put in place, both because of the informal sector problem and the non-tax payment problem. It was called monotributo, and it was a simplified system that unified taxes, healthcare, and retirement system. In 2004, this system was extended to vulnerable population, to all vulnerable population, in a program called social monotributo, which is put in place by law. Today, this law exists. In 2007, the government created the registration of national family agriculture. And for the first time, the government recognized the sector of family agriculture. And 2 years later, it created the social monotributo for rural social population. And this program was existed till 2018, and more than 50,000 families were able to have access to formalization and health and retirement system. Next slide, please. These three components were the main system of this program. On the healthcare component, this system was adapted to the heterogeneous needs of all countries. Because of distance, because of production, the access to the healthcare system was unequal. And here in Argentina, we have both a public and private healthcare system, but the unions, worker unions, also put in place a healthcare system. And this social monotributo permitted to rural workers to have access to the three systems. In the other hand, the second component was the formalization, and thanks to this system, the monotributo, the social monotributo, most of rural workers, of family workers, were able to trade, to sell their product, to sell the product to the government, to sell the product to small systems of commerce that they weren't able to sell, and then to have an access to the financial sector. The access to the financial sector was a key of the commerce, and now after the COVID-19 crisis, is a key policy for us. But the third component was the access to the retirement system. The problems we found in 2014 was that many families, many workers, many rural workers didn't know that the retirement was a right, was their right. And they didn't even know that they could have access to a retirement system. I had the opportunity and the honor to see the first family agriculture to had access to this retirement, and it was a very emotional moment. And because of this first example, then many workers and many organizations asked for this monotributo, this program, this right. Next slide, please. As I said, more than 50,000 families had access to this monotributo. And in 2018, this program was finished, and many families were in debt, and today they don't have access to this company. They don't have access to health system. They don't have access to a formalization of the production, and they don't have access to a retirement system. But we know that there are some limits to this program. The first limit is that it's a tool based on the vulnerability of the sector. Because of the vulnerability, they had access to a social monotributo, to an agricultural social monotributo. But it's the condition of vulnerability that permitted them to have the access. We are now working in a different point of view. Why? Because the family agriculture is not only a vulnerable sector, it's a productive sector, and it's a family productive sector. It's a different way of producing, where the unit of production is the family. So now, with the tax agency, with many sectors of the government, we are working in a different tool, in a tool based on the condition of workers, the condition of producers. And why is this important to us? Because this different point of view is permitting us to create a new tool, a tool which is adapted to all the characteristics of the sector. First of all, the distances. The distances, as in many countries, are high, and there is a big difficulty to reach all the producers. One of the conditions to have access to these policies is to be registered in the National Registration of Family Agriculture. Only to register the families in this registration take us many days of traveling. Now I'm in San Luis, province in Argentina, working with the producer and trying to registering them in the national registration. But if we change our point of view, and we will take care of many characteristics. For example, the period of payment. The period of payment in many tax systems is monthly, and is not adapted to the production of this sector. And if we change the point of view, and the condition of workers and producers is the main characteristic of this tool, will change this also, and all three components will be adapted to the sector. In some provinces, public system, public healthcare system is very good, and there is no need for a private system or a union system. But here in San Luis or in other provinces, we do need unions, we do need a private sector for a universal achievement of the healthcare system. And other problems we had, and with the COVID-19 crisis, this problem has been enforced is a lack of connectivity. We can create many tools, many digital tools, but there is a lack of connectivity in many parts of the country. So we adapt the tools to achieve all the workers. And finally, there is a high cost, not only in approaching producers, but for the producers to go to the cities, to approach it to the bank, to the government institutions. So what is our view now? We are changing this tool. We want to have a tool that gives the same right of the social monotributo to all rural workers, but adapted to the condition of workers and producers. Thank you very much.
Muchas gracias, Ezequiel. So your presentation has outlined the evolution of the simplified tax regime since its creation in 1998, and how the monotributo social agropecuario, along with the National Registry of Family Farmers, have been used as an instrument for not only formalizing agricultural workers and their operations and giving them access to healthcare and retirement benefits, but also as a means of recognizing small family farming as a productive sector on its own right. And one other point that I would like to mention is what you said about this not being an isolated policy, but one that works in tandem with the others seeking to promote financial inclusion and linkages to markets, which reinforces a point made in the reports, in the joint ILO FAO report that Shahra and Ben both referred to, about the importance of promoting policy coherence and coordination across sectors. So thank you very much for your presentation. And we're running a bit late, so let me remind the panelists, we've got a number of questions, and they can be answered in writing because we may not be able to cover them all. Those that cannot be answered during the course of the session, we will still respond in writing, and that will be shared through the socialprotection.org platform. So the last country speaker is Minister Aryunzaya Ayush, the Minister for Labor and Social Protection in Mongolia. She could not be here with us today live, but she kindly pre-recorded a video which we're going to be playing now. Thank you.
Distinguished delegates, ladies and gentlemen. First of all, I would like to extend my sincere gratitude to the International Labour Organization and Food Agriculture Organization of the United Nations for organizing such an important event. Mongolia's new social insurance system has been established in 1995, and it is legally possible for rural target groups, herders, and the self-employed to be covered on a voluntary basis. In accordance with respected legal regulations, social insurance officers are committed in all administrative units of Mongolia to fulfill those achievements. In other words, social insurance services and staff in 330 local small administrations in 21 IMACs, the provinces, provide social security service as one-stop shop, which allows herders and farmers and the self-employed to receive services quickly and at low cost. Taking into account that the income of rural population is actually instable, the voluntarily social insurance contract specifically states that the contribution can be paid on a monthly, quarterly, semi-annual, or even annual basis. For example, as herders earn income by selling cashmere and animal products in spring, they sell in summer more milk. The meat is sold more in autumn or winter. So the flexible payment schedule is closely linked to their income cycle. In order to maintain the social protection of citizens during the COVID-19 in 2020, total amount of 23.5 billion Mongolian tugriks were paid as social insurance premium for almost 170,000 voluntarily insured people. This measure is supposed to vital actions in order to prevent from the reduction of pensions and benefits for herders and self-employed in the future. In light with the common use of mobile phones and the internet for Mongolian citizens, both in urban and rural areas, herders and the self-employed have been able to enter into the voluntarily insurance, also to renew them using mobile phones and pay their premiums for social insurance by banking accounts, by banking applications, internet banking, mobile banking, QPay. QPay is actually greatly allowed to receive services regardless of time and space. Information on premiums paid by herders and self-employed people insured with social insurance can be obtained online through a number of electronic channels, such as official website of the organization, multiple organizations, social insurance agency, also the ministry, the applications, e-government services, small machines. So Mongolia is really very much developing its portal and applications. One of the 10 most commonly used e-services during the quarantine periods was actually Social Security contributions. So in 2021, the ministry has just introduced an electronic social insurance booklet and the pension books, and provided all the retirees with bank accounts and cards. This saves a lot of time and money for the insured and the pensioner, and allows all social security services be transparent. With this, I mentioned some good practices and achievements on social insurance issues, but we are still on demand on learning from others and for better social protection. So we are really right now working on new social security laws and legislations. I thank you for your attention.
Great. Thank you so much. So just to highlight a couple of points from the minister's presentation. One is the importance of having social security provisions anchored in legislation. I think that is the case of all 4 countries, at least when it comes to social insurance schemes. Second, the measures taken by Mongolia to conduct outreach and disseminate information widely using various different channels, and to streamline procedures for beneficiary registration and for payment of contributions through the use of internet and mobile applications. And third, and lastly, the establishment of one-stop shops providing a range of services, and the adoption of a flexible payment schedule to account for the volatility of rural incomes during the agricultural calendar. So these are all points actually which echo some of the innovative measures identified in the reports that we are launching today. So let me now turn lastly to because of time and to allow for Q&A, Christina is going to come towards the end instead of making her remarks now. Thank you so much, Christina. So I would like to turn directly to the Q&A. We have received a number of questions, a number of which are addressed to Cecilia. There is one question which is addressed to all the speakers. So I would like to invite any speaker to respond. It's the last question by Simon Steine, independent expert, former ILO senior advisor. And he is asking if speakers could give examples of cooperation with rural workers organizations in spreading awareness and access to social protection among rural workers. I pose the question to whoever would like to address it. Let me ask Ezequiel, in the context of the monotributo social agropecuario and the RENAF, I know that you guys do work with rural with producer organizations. So maybe if you want to say a couple of words, please.
Yes, the registration and the monotributo social is lead between the government and the organization. We work today. The Secretary of Family Agriculture is a member of a former organization, and we are working together with all organizations. And I have to say that the monotributo social agropecuario was free for workers. The government took in place the charge of the monotributo, and now the registrations and the monotributo are taken in place by organization and the state. And we also work with other government institutions like health and social protection institution, and the former organization. We are now taking in place a national registration of former organizations because we have the goal to register all kind of organization. Small organization, national organization, provincial organization, and to work together and to put in place policies, not only for family and worker, but also for the organization of worker families.
Thank you very much, Ezequiel. Anybody else who would like to come in with this question? Cecilia or Hazim, or otherwise we turn to some of the other questions.
Can I jump in?
Is that Ben? Please.
Yes, it's Ben, yeah. No, I mean, I think there's a number of good examples in terms of work through producer organizations in particular. So let's say self-employed agricultural workers. There's work that's ongoing with, for example, cocoa producers in Ghana that FAO has been working with. The Farm Forest Facility, which is an initiative, also an FAO, which works with producer organizations in a number of different regions around the world. There's also good examples of the member organizations in terms of facilitating access to social protection for the members. But I think there's less good examples of are agricultural wage workers, let's say, exclusively wage workers, there's a lot of examples of how they're excluded from national legislation and from national measures, particularly in terms of the seasonality and the, let's say, the casual nature of the work. And there's relatively, well, I don't have any good examples of inclusion. Perhaps others have good examples of inclusion for agricultural wage workers. Over.
Thank you, Ben. So let me turn to some of the other questions. There are several posed to Cecilia. One was a post by Michael Jerry, independent consultant. If you could talk about strengthening the payment system by using banks to pay beneficiaries, how effective is it, considering that bank branches are usually far away from rural areas where many of the extreme poor beneficiaries live? And shall I pose another one, Cecilia, for you?
Yes. Yes.
Okay, by Anton Bjork, who's a consultant with UN ESQA in Beirut. And one of the questions that he asked two questions. One of them relates to the NHIF and whether the expansion of the NHIF has increased demand for healthcare services. And if so, if healthcare providers have been able to cope with these increase in demand. Was that clear?
Yes. Can I go ahead?
Please.
Okay, thank you. On the question by Michael as to how effective banks are, considering that they are removed from rural areas, yes, the banks are far from rural areas. However, what they have done in our case is to engage agents who pay on their behalf. As per the contracts they have signed with the ministry, are responsible for social protection, the beneficiaries are not supposed to travel more than 6 kilometer radius to pick their stipends. And so the banks are supposed to ensure that agents have to be within the stated number of kilometers. On the issue of health, yes, the expansion has increased demand for health services, and the government is striving to increase capacity and services. There are gaps, of course, but I think these are gaps that can be addressed gradually. But the government is aware that the health system has been overstretched and they need to do something about it, because even as we do that, the government is looking at rolling out the universal health cover, which has already been piloted and it is now being rolled out. And as it is rolled out, then the expansion of health, the government is doing an increase of capacity and services to ensure that this can go hand in hand. Thank you.
Thank you very much, Cecilia. And I'm reminded, Karine, of the fact that the minister, there is a question posed for the minister, but the minister is not available during the session. But we did pose a question ahead of the session, and she kindly recorded the answer. So I don't know if Karine, if you're ready and you can play, or Marina, if you can play the minister's answer to the question. The question was if the minister could elaborate on the ways in which the self-employed and others outside an employment relationship can be covered by adapting contributory mechanisms and complementing them through non-contributory provision. And this is how the minister answered that question.
I thank you for your question. Well, in accordance with the law on social insurance of Mongolia, for the rural target groups, herders and the self-employed people, entitled to be covered on a voluntarily basis. So the law is enforced nationwide, and social insurance branches are committed to fulfill those provisions in all administrative units of Mongolia. But still, when they get into retirement, those who have not paid social insurance, they get social kind of pension from the other welfare fund. But at the end, it is very much important to cover all people in Mongolia, to cover with social insurance. Only then we can not only wait for the retirement, but also have all those services that are provided with the social insurance.
Thank you for that answer, Minister. There is a question for you, Ben, by Rubicon from Save the Children UK, and it relates to your reference to the volatility of income of producers and rural populations. And so the question is if you can refer to any mechanisms or combination of mechanisms that can be used to manage the seasonal and market variations and smooth the consumption of rural populations.
Well, I mean, I think it's clear that we need a variety of mechanisms, both contributory and non-contributory. I mean, I think kind of the common solution, the easiest, most direct kind of in recent times is clearly social assistance, cash transfer programs, which in a way are geared almost explicitly to give a kind of assured income, let's say, a regular planned income, so people can have that assurance that they don't have that volatility and that they have a constant stream of income, which really kind of changed their perspective in terms of what they can count on in terms of making plans and making investments and what have you, right? And so I think that's an important kind of immediate first step, but then building into longer term, more contributive programs, based on more sustainable livelihoods. And so, I mean, I think you need a combination of the two, and often sequenced, kind of depending on the circumstances. Thanks.
Thank you, Ben. There are a number of questions that we won't be able to answer during the course of this session, but we will provide written answers. So one relates to the political economy of social protection policy in Africa, asked by Ibrahim Mustafa from Nigeria. And then there is also a question about the aspects of gender responsive programming that have been shown to be effective in extending social protection to rural populations. One thing that hasn't come up in the presentations relates to the question of the portability of benefits, which in connection with populations, with the rural populations, which are quite mobile because of seasonality, seasonal labor, is something that the lack of portability is something that could disadvantage their access to social protection benefits, and it hasn't actually come up. So another one relates to, especially in this context, to questions of fiscal space, and there is actually a question by Sheila Marney from FAO. It's open to all the panelists, especially the country speakers, which relates to fiscal space and the question of financing social protection. And it says that the lack of, despite the fact that there has been a lot of political attention placed on social protection since the outbreak of COVID-19, there has been fiscal space is still an issue, which is related to lack of prioritization. So the question is if there are any good examples of country work being done on this, or more broadly, how the discussions on financing and the prospects for extending social protection are playing out in this context of limited resources, economic contraction, narrow tax base in many countries, and competing demand for resources in the post-COVID recovery period. So If any one of the speakers would like to talk to questions relating to financing and fiscal space, please go ahead. I see Shara.
Yeah, maybe I'll just come in on that. I mean, it's a really important question, and I don't think there are any sort of magic target, sort of magic bullet response to that question. But I think it's important to just emphasize that this is an ongoing struggle. And after, you're right, the crisis has shown the importance of social protection and therefore the urgency of mobilizing resources in order to invest in social protection systems. It's also true that the task of mobilizing those resources has not been made easier by the crisis. But as we emphasize, even in low-income countries, there are possibilities and options for expanding fiscal space. As you said, partly this is through what we have been discussing, expanding the contributory system, because that in a way brings earmarked funding into the social protection system, because you pay in as you and then benefit from the system. But also by formalizing more economic units, you also expand your tax base. So again, that is another way of increasing the resources that come into that come in at least to finance both the non-contributory system as well as to provide subsidies within the contributory system. There has been a lot of discussion about the need to expand, taxation, both through more progressive taxes, through wealth taxes. There's now quite a lot of discussion around that for all countries, including developing countries, both to bring in more resources into social protection system, but also to counter the rising inequalities, income inequalities that have been growing, in many countries, even during this crisis. So those are all options that countries need to really explore, and I hope that we can put in a link to the handbook on expanding fiscal space for social protection that ILO has produced, which provides many examples and is a very useful resource in terms of thinking about the importance of mobilizing resources both domestically as well as obviously internationally. There has to be also much greater coordination internationally on tax matters in particular, on closing tax loopholes which are depriving countries of resources, tax evasion, of reducing illicit financial flows, of better taxing multinational corporations. So all of that I think is absolutely key to this discussion, and I think that the only point I want to say is that there are options and they need to be pursued very aggressively. We cannot just say, we don't have the resources, therefore we cannot expand social protection and make it a right that is real for people. I think we need to work much more effectively on mobilizing resources using all options that countries have as we move forward after this crisis. Thank you.
Thank you, Shaka, for those very important points. And I see that Mira from ILO has posted the handbook that you just referred to on fiscal space for social protection in the chat box. So we are a bit past the time allotted for the webinar. We can continue maybe just a few more minutes, but we will need to wrap up. So maybe at this point, I would like to give the floor to Christina to make some comments, some remarks, please. Christina, go ahead.
Yes, yeah. Thank you very much, Alejandro, and thank you very much to all the speakers and all the participants for the very interesting questions. And so I think this has been an extremely rich discussion with a lot of experience and lessons learned from countries. Let me just, in the interest of time, make three extremely short and concise points. What could be really kind of the three kind of key messages that we could take out of the webinar. I think the first key lesson is really the fact that extending social protection coverage to rural workers and rural populations is possible. But it will not be possible without really adapting the social protection system to their situation and to their needs. And I think what we have seen in the country presentations and also what we've seen in the publication that we've just published is really that there are some keywords that really are extremely helpful. I mean, one is the question of outreach, active outreach to rural populations, really adapting to where they are, listening to their concerns and really proactively adapting the benefits provided and the way how the state interacts with them. And I think we've seen during the crisis now that this is possible. And I think this is really something that we should build on. Another two keywords in that context is really the keyword of simplification and adaptation, really making it easy for beneficiaries, making sure that the benefits provided and the modalities are also gender responsive and are taking into account especially also the needs of those who kind of are most kind of left behind and who are very, very vulnerable. I think this is important really in making sure that the social protection system can really respond to their needs. And it's absolutely essential to raise awareness and also build trust. And I think the best argument for this building trust is really that people see that they receive the benefits and the services that they need. And I think in that respect, this is absolutely critical. The second point I would like to make is really to look at a comprehensive and systemic approach. I mean, we have seen from the many examples that it's not sufficient to just look at social protection policies itself, but it's important to make the linkages also with other policies, to make the linkages with agriculture and rural development policies, with employment policies, with macroeconomic policies, with fiscal policies. So this is all essential to really make sure that the social protection system itself is reinforced and is better able to respond to people's needs, but it's also a broader contribution to enhancing productivity, to decent work, and to formalization. And the third point, which is very closely related to that, it's really now that these social protection systems are at the crossroads. I think it's important to really move forward together and progressively with a very clear time frame and striving for universal social protection, really making sure that everyone is covered, that there are universal social protection systems that cover everyone, that are responsive enough, flexible enough to also make sure that there is a degree of integration to avoid fragmentation of the system, to make sure that there is in the way how social protection systems are financed, that there is solidarity in the financing, both on the side of the tax system, but also on the side of contribution financing. So I think this is really absolutely important, also taking into account labor market mobility, making sure that the benefits are portable and transferable. And this is relatively easy to do in a system which is well integrated and well coordinated. It's much more difficult to do that in a more fragmented system. And I think what we have seen from the country experiences is really the efforts of really building a coherent and integrated system. And so I think at this point, when we are really at this crossroads now, trying to recover from the crisis, looking at ways of how we can reinforce the social protection systems to make sure that rural populations are covered is absolutely essential. And I think we can simply not afford not to invest in social protection systems if we don't want the world to be kind of seriously miss the SDGs. So I think now it's really the time for countries to reinforce their social protection systems for the future. Especially for rural populations, and ensure that these provide adequate protection for all. And I think with that, I'll hand back to you, Alejandro. Thank you.
Thank you very much, Christina, for those points, which actually provided a nice wrap up to this session, to the webinar. I had my own notes, but they pretty much match what you have said. Maybe I will just say, will reiterate something that Ben said, no, that in the sense that social protection is a human right enshrined in international treaties, and key to realizing other economic, social, and cultural rights, but it is also a good investment in and of itself, and an absolute necessity in the present context of global economic contraction. If COVID-19 has exposed something that it has exposed is that there are still very large coverage gaps that remain in ensuring that every family and every person receives the protection they need against risks experienced during their lifetime. And so it is imperative going forward that countries implement broad, comprehensive measures that will enable households to overcome the barriers they face and achieve progressively higher levels of protection from shocks. I think that the report that was presented, the cases, the country cases that were presented and discussed, and your points, Christina, are so some of the key features that I think that are important to bear in mind in any extension strategy. You mentioned innovation, and we had several examples during the session, from the one-stop shops and the flexible payment schedule in Mongolia, to the monotributo social in Argentina, to the linkage of NSNP beneficiaries with the National Health Insurance Funds and with economic inclusion programs in Kenya. Information and outreach, which you mentioned too, Christina, institutionalization. So Social Security provisions need to be anchored in national legislation so that access to social protection becomes an enforceable right, and that allows citizens to lodge complaints and to seek redress in cases of non-compliance. There is also a need for institutions, for an administrative apparatus, and for systems to be in place. You mentioned the need for adaptation. There is no cookie cutter formula for extending social protection to rural areas, and each country must find its own combination of contributory and non-contributory schemes adapted to its content, to its capacities and the specific needs and the heterogeneity of the rural population. The need for simplification of procedures for registering, for making contributions in the case of social insurance schemes, or complying with conditions in the case of social assistance programs, such as conditional cash transfers, and importantly, the need for financing, of course, which is a key bottleneck in many countries, whether it is with respect to social assistance programs financed from general tax revenues, or with respect to social insurance schemes for populations who tend to have low income and limited contributory capacity. So we need to close the webinar here. A number of questions we haven't been able to respond, but we will. I would like to thank very warmly all the speakers and the audience for the questions, as well as socialprotection.org for hosting the webinar. Note that the recording of the presentations will be made available on socialprotection.org after the webinar concludes, and that you will see a survey which is being announced now, which is going to pop up on your browser at the end of this session. Please take the time to complete it. It has been great to moderate this webinar. It has been a great collaboration with the ILO, and we will continue to work together with partner countries in ensuring that the right of to social protection becomes a reality for all, everywhere, at all times. Many thanks to all, and stay safe. Thank you.
Thanks, everyone.
Bye.